to the Dr. Taylor Show. I'm here with Whitney today. I have her case file, and she is going to be talking to us about the skeletal deformity she had called cleft palate. Hello, Whitney. It is a pleasure to be able to interview you today. I've always had an interest in cleft palate research, and I'm overjoyed that you agreed to meet with me.
Hello, Dr. Taylor. Thank you for inviting me to be on your show. Hopefully I can provide some helpful and useful information.
I'm sure you will. Let's get started. Are you familiar with any of the history behind the skeletal disease of cleft palate?
As a matter of fact, I am. In 390 BC, the first cleft lip was closed in China. However, it was not until 1816 that the first successful cleft palate operation occurred. Before this date, cleft palate surgeries were uncommon because cleft palate was thought to be secondary to syphilis, and doctors did not want to get that disease. Also, there's no anesthesia, and the operation is quite painful.
Very interesting. For those of you just tuning in to the Dr. Taylor Show and are not familiar with what a cleft palate is, I will enlighten you. A cleft palate is an opening or split in the roof of the mouth. The symptoms include difficulty swallowing or latching onto the mother, a nasal speaking voice, and recurring ear infections.
Oh yeah, I used to have a nasally voice and people would make fun of me.
Poor Whitney. There. When cleft palates occur, it is because the tissues in the baby's face and mouth do not fuse properly. Normally, tissues in the face and mouth fuse during the second or third month of pregnancy, but this does not happen like it should in cleft palate patients. This opening in the mouth results in several challenges for newborns.
Definitely. One of the problems I had as a child was not getting enough nutrition through my food because swallowing was difficult. I had a hole in my mouth. Also, some of the food or liquids I consumed traveled up to my ears, giving me frequent ear infections.
That does not sound like a good time. Do you know what causes a child to have a cleft palate?
Yes, the genes inherited from parents can cause a child to have cleft palate. This birth defect is prevalent in Africa, Asia, and the U.S. However, we have the resources to correct and fix the problem while other countries don't.
That is absolutely correct. How did your parents find out about your cleft palate?
Around the 18th week of my mom's pregnancy, she had an ultrasound, and the ultrasound detected my abnormality.
Oh wow, that must have been pretty tough. I know cleft palate takes several years to correct. Can you explain what you went through when you were young?
Sure. To correct a cleft palate, I had multiple surgeries over 18 years. Thankfully, I just had my last one not too long ago. I had my first surgery around 6 months of age. That surgery created a functional palate to decrease fluid buildup in my ears, and so my facial and teeth bones developed like they were supposed to. At 8 years old, I had a bone graft to fill in my upper gum line. Throughout my teenage years, I had to have braces and several additional surgeries to improve the appearance of my lip and nose, and to help me breathe better and to stabilize my jaw.
Oh my goodness. It sounds like you have spent a good amount of your childhood in hospitals and in recovery. For any of you ladies trying to get pregnant, or who are already pregnant, I have several tips to prevent your baby from getting cleft palate. You need to make sure that your immunizations are up to date before pregnancy occurs. You need to eat properly and take prenatal vitamins. Do not partake in the use of tobacco or alcohol while pregnant, and if your family has a history of cleft palate, you might want to consider genetic counseling. Certain risk factors include diabetes and the use of certain seizure medications. Whitney, do you know the countries that are affected by cleft palate?
I certainly do, Dr. Taylor. It is the most common birth defect in the U.S. following Down syndrome. It happens 1 out of every 1,000 live births. However, it is more common in Asian and Native American populations. Contrary to popular belief, it is not as common in African Americans. For Asians, cleft palate occurs 1 of every 500 births, and for Africans, it's 1 out of every 2,500 births. Just cleft palate by itself is more prevalent in females and accounts for 1/3 of cleft palate cases. Cleft palate paired with cleft lip is more common in males.
Absolutely right. One of the things that angers me most about this skeletal disease is the misconceptions that people have about it. They think that the surgeries are purely cosmetic instead of necessary. As we said earlier, cleft palate surgeries continue to occur through age 18. People tend to think that after one surgery, it is completely taken care of. Whitney, is there anything you would like to add before we wrap up?
In fact, there is. I just have a couple interesting facts. Approximately 1 birth per hour in the U.S. involves a cleft deformity. Also, the rate of cleft palate cases has not changed for centuries.
Thank you so much for your time, Whitney. I will see you all next week on the Dr. Taylor Show, and we will be discussing circumcision. Should it stay or should it go?